So I'm going to really just kind of talk you through, my path and my journey and try and just drop some pearls along the way. So I have nothing really to disclose. This is a disclosure that I stole from the chair of surgery at the UCSF, who, you know, it's this is actually really important. A lot of what we have to say is very much, influenced just by how we live our life and the experiences that we've had, et cetera. And so, I don't have anything official to disclose. Probably the most important thing really is that I'm a recovering Northeasterner. I've changed a lot. So just a little bit of background. So I came from a family, very clear priorities. I was the fifth of six children, and it was church, it was school, and it was family. And that was pretty much it. It was definitely a very hyper competitive environment. I think the Northeast in general tends to be that way. I remember moving down here and no one asked me what I did or where I went to college, like for months. It was a very strange experience. But even within our family, though, it was pretty hyper competitive. We always had to sort of one up each other, which is not always the best environment. But I knew early on that I wanted to be a doctor. I just knew. And I think, I wasn't cognizant of it, but certainly when I look back, I think, well, I've always loved puzzles. I love problem solving. I'm a visual person. I like to do art and draw. I knit. I do lots of different things like that. So I knew I was going to also probably end up doing something very hands-on. And that's not necessarily just surgery. I think just being a physician in general, you're a hands-on person. It's physical interaction. I really craved authenticity. I think that's why I'm not a lawyer or in business. I wanted that opportunity to have those relationships with patients where you really could just get down to the nuts and bolts. And then lastly, I was motivated. My childhood was a little bit nuts. It was stressful in a variety of different ways. These are all my cousins on just my dad's side. And I'm that baby there. I'm 1 year old, I guess. It's 1973. And then the other woman circled is my oldest cousin. Her name is Maureen. She goes by Killackey. And she was a surgeon. She had gone to Barnard. She had gone to Cornell for med school. She'd gone to Sloan Kettering. She was a gynonc. She was the first woman president of that society. I mean, she was everyone in my family. And we were pretty much a blue collar family. My parents had gone to college, but not many others had. And so this was just, she was on a pedestal, and I wanted that as a woman, especially in a family that had some traditional values about men and women's roles. So pearl number one is find your why. I'm not sure. This is my plug for Simon Sinek. I don't know if you've ever seen any of his TED Talks. I recommend it. When I saw this for the first time, I thought to myself, it brings it all together for me. It really makes sense. And what motivates yourself, but what motivates people? And so as I was going into leadership, this has been incredibly helpful to me because, I've seen the difference between a group of people having no purpose and a group that has had purpose, and it is a game changer. So I've always liked lots of different things. I've always been interested in art and in music, psychology, sociology, again, why people do the things that they do. And so when I moved to Columbia for college, it was really serendipitously the perfect place for me. It's has a 100-plus-year-old core curriculum, which in some people feel like is a bit antiquated. And there are a lot of antiquated parts of it. But what it really does is it forces you to really at least be introduced to a myriad of things. And so I had this opportunity to do, dive into early Netherlandish painting, intensive in jazz courses. I learned all about Japanese classical literature. I never would have done that before. I discovered my favorite artist, Magritte. And then, of course, I did my science, neurosciences. My professor, was just incredible. And his wife was even more incredible. She was the 12th woman neurosurgeon in the country, a pediatric neurosurgeon, and she actually kind of co-taught the class with him. So it was a huge influence again. And I think, as I look back, and I'm sure as you all look through your lives, you realize there are certain times or moments that just stick out. And, you might not appreciate what influence it's having in the moment, but it certainly does have lasting effects. And so I loved it all. So I kind of did the bare minimum for medical school. And really, I think the other thing I took away from this was just to appreciate that, don't be married to one set of beliefs, and that lots of different things, and different perspectives and different, personality types, just diversity in general is so important. So pearl number 2 is hone your communication skill set, and doing this, experiencing education and learning in a variety of different modalities really forces you to hone those communication skills. But again, appreciating different things, and not being married to one set of beliefs. So then I moved into medical school, and again, I loved everything. I went through third year as one of those people who just, every time I was on a rotation, it was great. Even early on, I just loved disease processes. I loved rheumatology. I loved immunology. I loved psych. I loved neurology. When I got to my surgery rotation, I'm not a morning person, and all of a sudden I was waking up in the morning, and the day would fly by. And I really took note of that. And I also just felt like I sort of found my people. I don't really like using fitting in general, just because then you're just creating a bunch of clones, and that's sort of the antithesis of diversity. But, I do think it's important that you're going to be around people that think similarly to you in the process way, I would say. And also, I think it's finding environments where you thrive. And I always encourage students and residents, when they're thinking about their next steps, to really think about that. Like, where do they feel like they can thrive? And it's certainly the criteria we use when we're selecting residents for our program. So this is also a really difficult time for me as well. And it's a tough time for a lot of people in medical school. You're really kind of growing up. You are establishing independence. And sometimes people come to medical school and they've sort of lived a bit of life. I didn't. I went straight through. But even then, you're developing this identity that continues on in your training. And I had to make some choices. I come from a volatile family, actually. My father was an alcoholic. And this is when I started my journey into therapy. Although this started 14 years, I really got into it in 2002, and it lasted for about 10 years. So this was vital in changing my life. And I encourage everyone to go into therapy. If you even thought about it, if you ever think about it, don't be ashamed of it. I was so embarrassed when I first started. But what it allowed me to do is finally appreciate, kind of who I was. And actually the person I was because of all those things that had happened. And so grateful to be able to come through that other side of it with that, because it's allowed me to really be an optimistic person. I think my tendency is to be optimistic, but I think knowing that I can get through tough times has really allowed me to then go and take other further risks throughout my life. It's also allowed me to be more of an open person and just share. I was very embarrassed, but being vulnerable actually ultimately over time makes you stronger and braver. So pearl number 3. So I was a perfectionist. Many of us in medicine are. And one of the other things I also realized through this time was that it's not attainable. And I didn't like fix this. So I'm still a perfectionist, but at least I'm more aware of it. And I look back and I think about all the energy I have spent trying to achieve perfection in so many different domains of my life. And how that energy could have been put to much better use. So if there's anything I can influence y'all on today is to really think about what you're spending your time on, and just what is it you're going to get out of it, whether it's for yourself or for others. So I'll just jump right into pearl number 4. So resiliency. So again, I was able to appreciate where I came from, and that all of this, all my experience had made me the person that I was, and tenacious. So in medical school, I loved everything, like I said, but I knew I wanted a family. I wanted lifestyle. My dad was a huge influence in my life, and was I doing this because I wanted to make him happy? Did I really want to do it? But ultimately I realized I did want to do, or at least I felt like I wanted to do surgery. I love pediatric surgery. And Dr. Spencer Amory here was a huge influence, but one of my first main mentors in my life. I did my acting internship with him. And At Columbia, the way you do that is you actually spend the entire month with that person. And so we had lots of time driving back and forth between the different practice sites on the Henry Hudson, and had lots of deep conversations. And I'll never forget him saying to me once, you're going to have to wake up and do what you're going to choose to do in 20 years. So you better choose the thing that you really want to do. He also helped me realize and not feel bad about the fact that I knew my talents were really in the clinical realm and education. I was one of 20 students applying in surgery, and most of my colleagues were like looking at the Brigham or Duke, all these like fancy places. And, I realized I don't want to be a chair, so I didn't really need to go to any of those programs. And it's funny because it is something I used to say out loud a lot. And here I am, of course. So listen to your trusted mentors and advisors, even if you don't necessarily want to hear what they have to say. And start to learn to follow your gut. I don't think this can fail anyone. Being able to hear it can be hard, but I think as you hone that skill, I'll talk about it again, I'm sure, because it's a big part of my life. I think it makes it easier the next time. So, and to be very much aware of should decisions. It's funny, I had a student come, so it's time to put your rank list in, and I had a student come run their list with me, and very successful student, lots of great places, but really loved her interview at a few places that aren't like top tier. And so she was ranking them ahead of places like Penn or whatever. And when she was talking, she said, well, I think I should, this and that. And, we all go through it, and it makes, and I understand why. So I feel like my role in that moment is just to reflect back and just ask them to think, should you do that? Or is it something that you really want to do? So then I found myself in Rochester, New York, Strong Memorial. If you don't know where Rochester is, that's where it is. Lots of snow and gray days. So I'm happy to be down in the South. It was an opportunity to reinvent myself. Every stage is, many of us have been through different stages in our lives, but it's a huge time of rapid maturation, really finding that identity as a physician. And again, I loved every rotation and I always, I love to learn, I guess. I really love vascular. I included some of these pictures because over on the right is sort of the old way, the open way of repairing the AAA, for example, abdominal aortic aneurysm. And I got to do 50 of these in my residency. But we were at a place that was sort of cutting edge, and they were starting to do these endografts. It was sort of like a brand new thing. And I could see the way that specialty was leading. And so I thought, I don't know if I really want to do that. So I found my way to transplant, which is actually vascular with nice blood vessels and no feet that have problems. It brought in that immunology love that I have and an opportunity to potentially do pediatrics. You have lifelong patients, which I always knew that that's something that really drew me to medicine, to have those relationships. And but then again, I was thinking lifestyle, what am I doing? This is crazy. Could I still have it all? And I think that this was probably the start where I started thinking to myself, having it all actually is completely your definition of what all means, right? So, and only you can figure that out. So, and it can adapt over time. And so I can stand here thinking and say, I feel like I have it all. Someone else may look at it and think I'm nuts because I take a lot of call, but it's your perspective. But these are the three surgeons that had a major influence on me. And I guess the other point to make here is that I think you get, you get influenced by the people around you who are really passionate about what they do and are just loving it. And I was in my residency. It was an interesting time. I actually never really had a chair. Someone retired, there was an interim, someone came in, they got in a terrible biking accident. So then I didn't have a chair. It was kind of nuts. So it was really important for the surgeons that were there working. They had a huge influence on us. And so this guy on the right here, lots of other problems in his life. However, he brought living donor liver transplant really to the forefront in the United States. And he happened to be at Rochester. And so it was just super, he loved what he did, as did the other two. And so I wanted to be part of that. And that's really how I ended up choosing it. So, I think, again, this is what I was getting at, I think being adaptable and sort of, pivoting when opportunities come or thoughts about what you might want to do that may be different from what we thought it was going to be, being able to be adaptable to that idea and the willingness to take that risk. I just had very confidence in myself that I would be able to make it work. And so again, having it all can mean many different things. So also during residency, there was a big time of transition. And this surgeon, who's a vascular surgeon in Florida, his name is Sam Halaby. I'm so grateful to him. He was a good friend. And as a woman, I don't know if you guys are familiar with the New Yorker art cover that came out a few years ago, and then it's sort of been tried to be remade by thousands of different groups of women surgeons. But it's the hashtag Look Like a Woman campaign, because there are lots of women surgeons. And I was a first year as an intern, I think it was, and I was one of 6 kids. To survive in that type of environment, you kind of have to create a skill set where at least I felt like I needed to sort of be charming, and I tend to be more gregarious, and I'm an extrovert. And I went into medical school and college and sort of did those things too. And I came to residency, and he sat me down one day and he said, do you want to be treated like so-and-so, a woman chief resident, when you're a 5th year? Or do you want to be taken seriously? Because if you do, you need to stop right now and just do your job and stop doing all this other stuff. And part of that was me probably being a little immature, but part of it was also the fact that I didn't have to be different just because I was a woman. I could just be myself. And I'm so grateful to him. So, good friends, they're honest friends. And he really helped me begin to see that just being myself was going to be the most honest and authentic way to proceed through my career and would be the most successful. This is my program director, James Peacock. He went to Tulane. So we continue our still good friends. And this is a moment in my residency that was also really hard because I was pretty competent. I was the strongest one in my class. And so when it came to choosing administrative chief residents, I thought I was the obvious choice. And so when I did not get that job, I was very upset. And I went to him and sort of stormed into his office. And he said, people are afraid of you. They don't come to you. That you're kind of judgmental, you're tough. And the residents in an administrative or in a chief resident really needs someone they can go to who's going to advocate for them and also be willing to just, listen and not try and fix everything. That was a mirror in my face. I think I probably knew it, but I didn't know how much it was having an effect in my career or on other people. And I'm so grateful to him for saying that to me, because it really changed my perspective. And you realize how much your actions do have an influence on those around you. I know that sounds sort of obvious, but I don't know. I have to go through life sometimes and experience these things. So good friends, again, they're honest friends, and sometimes it can be really hard to hear. Yeah, I don't have a picture of this last surgeon that I wanted to talk about from my residency. His name was William Fiore. So I just put up, it's funny because these other guys, Ken Oriole and Dick Green and Joseph Gear, huge vascular surgeons in this country. And Dr. Fiore stayed in Rochester. He was a community vascular surgeon, very strong Italian background, old school surgeon, a little bit cranky. And he was probably in his late 60s. So anyway, I'm a 4th year resident. I have a 2nd year resident under me who actually does have issues with women, I think, in authority. And we'd had butted heads a few times, and I ended up catching him in a lie about, saying he saw a patient that had actually died, et cetera, et cetera. And so we had gotten to the point where, he had gone to my program director, and it was just a whole mess. One thing I will say is in that moment, I also realized I don't want to be this person who gets angry. I want to be someone who is, that I don't put myself in those situations. But the most important part of that experience was the next day, because he had witnessed this sort of this conflict that the two of us had. And he said, asked me, he's like, do you see yourself as different and or like less than or something other than a competent surgeon? And he said, if you walk into the room as if you're different, then everyone's going to see you that way, or at least you're going to think they see you that way, right? You're going to have that perspective. And so his advice to me was, don't make this an issue. It really but move forward expecting to treat you like everyone treated you like a competent doctor that you are, and not as a woman doctor. And I've struggled with telling that story for a long time, because I thought, oh my gosh, am I saying this? And I know that there are issues with, inequity and discrimination for women in medicine. So am I, being, a traitor to the cause, or letting people down? And, I think I fall back on that whole idea of just being honest and authentic, because this is what it meant for me. And I can tell you, it absolutely changed the course of my career when it came to, being in surgery and being in transplant. I'm often the only woman or one of few. And I don't really care what they think. I mean, I do as a human being, but I can't control it. I know I can't control it. And so I just move forward, keeping my head down and just trying to make the next right decision. So you can't please everyone, right? And you can't certainly make them think anything specific about you. You can really only change or influence someone's mind. So that getting to that point and that understanding, I can't tell you, relieved so much anxiety and stress and energy that I was putting toward that. So I ended up following residency in transplant, moving back to New York City, and I did my fellowship at Mount Sinai. Again, it was an opportunity to reinvent myself. But fellowship is a time also where you just have to learn as much as you possibly can and sort of like hunker down. It really was a blur. I'll say those 2 years. The person on the left was my co-fellow, and I know the two of us would not have made it through without each other. The one in the middle is one of my favorite attending for my training. And I think that this is where it's important to really begin to think about leaning on the people around you, and not isolating, which can sometimes just be easier because you're exhausted. But really being open and sharing your concerns and the stresses in your life with others around you, especially those that understand what you're going through. I had set some goals, and I think this was, one point in my life where I did feel like, okay, I have to do this. I need to be a role model. No woman had actually finished the first 2 years, the 2-year fellowship at Mount Sinai. It had been around maybe 15, 20 years. And I was determined to show them that a woman could do it. And so these are all my co-fellows over the course of 2 years, and we all helped each other get through, but they certainly were, integral to that, making it. I will say, as a woman, I'm pretty organized and like to do schedules and things like that. And so these guys are like, they couldn't schedule a vacation or time off to save their lives. And so I think having me also is really helpful for them. But you need to persevere, in tough times. And I think and hold on to that purpose beyond yourself. I think that really helped me get through, realizing that, okay, this isn't just about me, like trying to get my transplant training. This is about me setting the stage. And there have been multiple women have gone through since then. The other pearl is to lean on trusted friends, like I mentioned, and to create what has been referred to me as a board of directors in your life. And you really need to have people that serve different purposes. So, you need to have someone who's always just going to listen to you, because sometimes you just need to unload and you don't need anyone to say anything back. You need to have that friend who's going to tell you what's hard to see, not necessarily that it's difficult, but that you get so caught up in your own stuff that, they just have a really good perspective on things. You need mentors. You need your family in your life. I've got a couple of people of my family up there. The guy on the lower left is the person who recruited me to Tulane. The person in the middle is my executive coach currently right now. And so I think, whether you pay for a coach or you have someone that's a coach just in general, who's there to, push you and hold you accountable, but also give you those pep talks in the times that are tough, I think are really important. So think about this in your life. My first job, actually, before I went to New Orleans, was in Philadelphia. And it was because I'd been away for so long. My father was dying, and I thought, I need to be kind of closer to home. And he died the day I was supposed to start my first attending job. But it was really, I don't regret it for 1 second at all, because it allowed me also to reconnect with my mother, who we transitioned over that first year into assisted living. And it was a way for me to reconcile a lot of the things that had happened in my past life with them as an adult. And, realizing that I could exist and be happy and provide happiness to myself, and not rely on them to create that for me. So it was a really important year for me. That year, though, I remember kind of waking up almost, and I slept a lot, I will say, that first year. But realizing that I had not put any energy into anything else. And I was finished, right, with all my training, but where was my other life? Where I wasn't married. I was supposed to be married with 2 kids by the time I was 28. I was 32, nothing. No, I wasn't anywhere close to that. And my sister and others, helped me realize that you actually have to put effort into other aspects of your life that don't just come and show up. And so that was really important to me because I think it helped me start to regain balance in my life. But that first year was really, I refer to as a reentry or into civilization, because I had really kind of cut everything else off, all my other interests. It helped me put things into perspective. And it can be hard, in medicine residency, because it really can be all consuming, and it's your life for a lot of your time in it. But I got the PostKatrina call, that person on the other side. We had overlapped each other a bit at Mount Sinai, and our mutual friends had both said, you guys are kind of like normal surgeons. Like, it would be great if you got a chance to work together. So he called. I said, are you crazy? I'm never moving to the South. I'm one of 6 kids. I've got 10 nieces and nephews. I'm staying put. And he said, I think you should just come down and take a look. I think we've got something special. So I did. And I'll never forget, actually, Dean Ham was the chair of medicine, I think, or something, interviewing me. And I remember being in that interview. And you know how day-long interviews are, sort of at the end, you're sort of, even though someone's talking, you're kind of thinking about, you're kind of, processing things. And I just had an extremely strong sense that if I had come here, I think things in my life could happen that I never even could imagine. And so it took me a while to take that risk, did a little bit more therapy, did a little intensives, things like that, to really think about what it was that I wanted in my life. And, but ultimately I trusted my gut and took that risk. And again, it was terrifying. It was terrifying telling my sister I was leaving, but, and she still asks me when I'm coming back, and it's been 16 years. So I don't think I'm going back, but those experiences can get easier and easier, because you trust yourself more and more, and you can hear your gut more clearly. So that first decade of being in New Orleans was total chaos. I didn't even put on here, getting married, buying a house, had a baby right away, had a second baby, the one on the lower right hand, that's my daughter. Like, it's a perfect picture of her and what she's like. She's chaos. But right sort of in the middle of it, the guy on the left who recruited me left. He went back to New York. But I wasn't in that position. I wasn't in a position to be able to move. And I think I knew I shouldn't anyway, because you can't recreate things. I remember having said to myself at that point, God, my job is like life, everything's perfect. I'm married. I love my job, this and that. And it didn't last, but it created a new opportunity. And for those of you who may or may not know Dr. Jaffe, he's an old surgeon here. He called me into his office shortly after Sandy told us he was leaving. And he said, I know you don't believe this or understand this right now, but this is probably the best thing that could have ever happened to you, because you do have to, in surgery in particular, and I know a lot of other specialties, absolutely. But I've seen it specifically in really sort of like high stress subspecialties. The first few years after your training are terrifying, and you have to get your feet on the ground and actually really appreciate and accept that you are independent, but that your learning has not stopped, and that's okay. You don't need to go out and do the toughest case the day after you finish your residency or your fellowship. But that, if the fundamentals are there, it's sometimes being forced to then take that step to be independent can be scary, but it reaps benefits. And so I stayed put, and ended up being named head of transplant. Ultimately, I let that other sheet I have there, and is that we got in trouble with CMS, and transplant is very regulated and has a high profile in the hospital. And so the reason I include that is because the person that came to replace Sandy was not, he was sort of like the definition of what not to do as a leader. And so it provided me an opportunity. I didn't really even think about it. I just had stepped up and tried to help keep the program going. And that brought me a lot of visibility. So ultimately what ended up happening, however many years later, was the Department of Surgery was in a bad way and needed someone new. And I knew everyone. I didn't have a lot of skeletons in my closet. I'm kind of a boring person. I go to work and I go to my family and I go back to work. It's not, there's not a lot of extra going on. But I had a relationship with the dean, like I'd known him. He was a nephrologist, so I'd interacted with him as a colleague. And but what really happened was that I had a sponsor I didn't know about. So the dean's sort of right-hand person was a woman named Mary Brown, who was a healthcare executive. She's not a physician. You know, we had started meeting because of transplant, and she just saw something in me. And I don't think I realized that. She didn't say anything. And she put me in positions where she could sort of test my ability to coordinate things. So why she put me in charge of a search committee for a chair. And I'd never been on a search committee really for anything. And I thought, this is nuts. And she said, we're going to get you through it. Don't worry. It was a successful search. And a couple of other things. And so she had put the bug in Dean Hand's ear. I don't have a traditional portfolio. I don't have R01s. I have publications, but not a ton. And so not exactly your traditional portfolio for a chair. I was really interested in leadership though, because I had started reading about it and realized actually some of these things in books and that you learn about, and if you try and apply them, they actually work. And so I had gone to a leadership conference by the AAMC from mid-career women. And at that meeting, there was a presentation of a paper called The Future-Oriented Department Chair. And you know, all of a sudden it made sense. I thought, okay, I'm not the only one thinking the setup that we have by these kind of older white guys at the end of their career being department chairs. This is not going to work long term, right? This is no longer the current. It's a much more dynamic job. And I was so excited. I thought, oh my gosh, people realize this outside of just like me. And when you read through the article, the skill set that they talked about, I thought to myself, oh my gosh, I think I have this skill set. So I came back, it was December of 2015. And I said to Mary, I said, I think I want to be a department chair, but I don't have the pedigree. And so we set up this sort of 3 to 5 year plan so that I could get my portfolio or, you know, my CV up to snuff. But then 4 or 5 months later, they needed to make a change. And she came to my office and said, we'd like you to do this. And I thought, you mean as interim? And she said, no, interims don't make decisions. You got to come in and do it. And, you know, I had the fortunate advantage of having known everyone here. So I said, can I have the weekend to talk to my husband? And I'm, by the way, all of this is only possible because of my husband staying home with our children from day one. There's no way I could have done any of this. And I certainly wouldn't be in this position without that. So I went home and we talked about it. But I think, you know, obviously what he had to say was important. He's always been incredibly encouraging. So I knew he wasn't going to say no, but more importantly for me, I wasn't going to be able to live my life asking what if I had, right? Or regretting that. I just thought, I'm going to take the chance. And what's the worst that can happen? I fail. And then I go back to being a surgeon and, you know, et cetera. So, but it was a huge risk. I had major imposter syndrome, both locally and then certainly when I started meeting a lot of the chairs outside and around the country. I got a coach that helped me with that specifically, but after a few months, I didn't need any more pep talks. I needed someone to hold me accountable. And then brought my current coach in, who I've had for the last 5 years, and she's fantastic. So anyway, so since I've been in that position, before I get to that, this is really important. I think, and I think that this is important, particularly for not just for women, but for people who want to really have that balance and be able to spend time outside of work, whether it's with family or friends or whatever. You have to set boundaries and actually stick to them. And that was one of the most difficult lessons I had to learn. And I physically had to like make myself, you know, tell my partners, I'm not going to live your chaos just because you can't plan your life. Like, here's a schedule. I'm not changing the weekend call coverage just because you come to me the day before, because you want to go out of town. So, and those are the little things, because that's going to affect my life and my ability to spend time with my children. And so I think that doing that as best you can. And this is where it takes people who are going to push you and people who have clarity, sometimes outside of what you can see, to help you get there. And so, because to keep them, you really need help. So the lessons I've learned so far as being chair, and this is my last slide or two, all of my life's experiences led me to this. But looking back, I realized, okay, well, I took risks. I kind of wanted to do something that I wasn't sure about, and I went ahead and did it. And, I think while I never really planned for being a chair specifically, I think I probably always was on a path for leadership. I like to be involved in the current environment that I'm working in or living in, and like to make things better. And so I think that requires leadership, and I've done a lot to learn about it. It's a science, absolutely. People are naturally attracted to leadership. I think some people have, some skills that make it easier for them. But without a doubt, you have to study and read and learn about it, and then practice what you learn. And, if it didn't work the first time, doesn't necessarily mean you should give up on it. Might have been just a different situation. And so just being very aware of that. It really helps to have a coach. So figure out the greater purpose. That is really the main thing that has kept me going. This is a tough job. It's a tough environment here at Tulane. It's a tough environment in New Orleans. It's a complex system. There's a lot of energy wasted on sort of these conflicts between LSU and Tulane, or whatever, that really hold us back from being, as we could be so much better together. But sometimes there's just history that gets in the way of that. So figuring out that greater purpose, and what that required for us specifically in surgery, was having a shared vision, and that process of creating that shared vision. What do we want to be? Like, what does it mean to be a Tulane surgeon? What do we want to contribute back? Tulane has a name that gets you in the door, but we weren't really living up to that name, in my opinion, in our opinion. And so, but we had this great history, and a great history of innovation. And so, we focused on the things that were really important, and the things that we could really succeed in the short term. I've learned, this has been really hard, to refrain from judgment, and give the benefit of the doubt. I do think that sometimes, I think the surgical part of me is like, I just want to make the decision quickly. And I can't tell you how many times where I've either not gotten the answer in the timely fashion that I wish I had had, or whatever circumstances required time to pass before the ultimate decision was made. And clearly the final decision ended up being much better than what I initially thought should happen. That's I think it's just important. And I think there are people who are innately better at this than others. And so, if it's hard for you, give people the benefit of the doubt. And it can be really hard to see the other side of things when you are upset. Admit when you're wrong. Humility is really precious, and it goes so far with gaining trust and keeping your team members part of your team. I think that's, to me, I think recruiting is a big deal, but retention is actually harder, and more of it requires more art, especially because a lot of the things that you need potentially to retain people are not things you have control over. Don't send the email. Hopefully you all understand what that means. I mean, my gosh, how many times do you get so angry and you're just like typing really hard? And I've sent so many emails to myself. I tell my faculty, residents, whomever, send me the email. Either I'll edit it for you, or I'll just tell you not to send it. Because sometimes it just feels so good to hit send. But in the end, 95% of the time, you never end up sending it. Because what you really hope to gain from sending it is actually never going to happen. Be kind, and be willing to have those difficult conversations. I think it's a kind thing to do. It's sometimes really hard to tell someone, I'm not sure if you're aware how people are perceiving you. And that has, I think is a kind thing to do for that person, but also, even though it's difficult, because it's not really about me, it's about what's right for the department, it makes it a little bit easier to have those tough conversations. So be a sponsor. I mentioned this earlier, the difference between mentorship and sponsorship. You may already know this. Mentorship is really being someone to help guide you through a process, Oftentimes people find mentors because that's who they want to be and they want to work toward that. Sponsorship is really proactive. It's recognizing those around you and sort of what their talents are, how they could be, or what can you do to make them learn a skill or gain an experience that's going to take them to the next level. And so, it's being able to do that and then watch the success is really fun. Get out of the way of others. That's something I've certainly been working on the last few years. I've got some amazing faculty. Be okay with 80% most of the time. So it's hard for me to hear as a perfectionist, but it's so true. I think especially for women, I think it's been written about a lot that women tend to feel like they don't apply for jobs unless they're like 150% confident. It's generally not the same for men, but I mean, of course, these are not all hard and fast rules, but I think that if you really do try and do it 100%, you just can't sustain it. But also it's most of it's okay and it's going to get the job done. Use your influence for the common good and to help find your passion. So this is where I guess I would leave you just telling you about that. Yes, I'm the chair of the department, but my biggest passion is about professionalism for a variety of reasons, from my career and from life, et cetera. It's not optional. Actually as a physician and certainly not in our department. And so I've had this opportunity to develop a program here at Tulane for professionalism. And I'm in the position where I can do it, right, as chair, because I can say, okay, well, we're going to do this in the Department of Surgery, and if surgery can do it, then no one else has any excuse. And so, because surgeons tend to have the stereotype of being, the least professional. And so if we can turn that around, then so can everyone else. But that's a huge passion for me. And so it's a luxury, I realize, of being in my position that I can sort of find that thing that's important so I can contribute back to the school as a whole. And then the last thing I would say is just get comfortable with ambiguity. It's being forced on us daily. Even before COVID, this is something I used to talk about because so much of what we face, especially in medicine, we just don't know really what's going to happen. And that can often cause a lot of stress. And so in an effort to just decrease stress in general, decrease burnout, decrease depression, decrease suicide in medicine, I feel like our responsibility is to be able to teach and, role model being okay with some of the stressors or figuring out how to get through them. Because they're not going anywhere, a lot of them. So anyway, I want to end on a high note. So the last thing I'll just say is that through all of this, I think our department is really committed to diversity. And sometimes it's shocking to me that you have to kind of explain why it is important or how it works. But I think being a woman, I've been able to really see firsthand how having a seat at the table really can make a difference. And that's just one specific example of a diversity identity. So with that, thank you so much, by the way, for letting me share this experience. It's always good to kind of go through these things. And I'm happy to answer any questions and certainly always available to chat if I can help anyone in the future.